My name is Joe Guilfoyle and I'm a Luke's patient. I started the national campaign to save this wonderful hospital in 2006 as soon as I heard Minister Harney planned to close it. Our committee is a national one because this hospital is a national treasure.
Cancer is a long-term illness, and my God, if you've got it, you want the best outcomes, you want the best treatment, you want care soon and whatever. But there's a lot of patients in Ireland who've been to Luke's, they've experienced it, so they are experts too, and they were not consulted.
Closing St Luke's is central to the plan to privatise our health system. We are now rushing like lemmings towards an American healthcare system.
The present situation is very worrying for existing Luke's patients, it's appalling for the staff.
St Luke's is the only specialised cancer hospital in this country, the only one of its kind. It is a centre of excellence. You can have all your treatment under the one roof. You can have your chemotherapy, you can have your radiotherapy, you can have your complementary therapy there.
The fact that everybody in Luke's had the same condition, it was like each one could chat to the other of how they were getting on, how they felt.
The difficulty with me having to be rushed from St Luke's elsewhere was that the elsewhere were not able to deal adequately with my problem. I cannot see how you can close your existing centre of excellence on the basis that you're going to offer a poor service somewhere else.
When my husband was diagnosed with cancer, unfortunately he was in a very busy general hospital. The night he went into the hospital, he lay on a trolley for 14 hours.
I lay on a trolley for 8 hours with people coming and going. I was moved 3 times from one bay to another. At one stage I was out in the corridor and then somebody came out and said, "What's he doing out here? Bring him back in." The pick man, they were calling me the pick man, you know.
I felt so sad that he was lying there wondering when he might go for his PET scan, wondering what was in store for him. And I felt so sad that I couldn't have him transferred to St Luke's, where I worked.
With St Luke's, I started going there in June, which is about 4 months ago. And the minute I walked through the door, just the warmth, the kindness of the place just immediately hit me.
When you have cancer, you're in such a mental state and physical state that you need a place where absolutely every need you have will be taken care of.
There's one time recently I needed an ultrasound done on my liver because I worried about the effect that the chemo drugs was having on it. And I was actually lying down waiting for the doctor to come in and do it. And he got delayed by about 20 minutes. And during that 20 minutes, the head nurse came in and sat down beside me and just chatted to me, you know, just talked to me. I wasn't left there by myself.
The environment, I could go up there and I was relaxed. I got to know the nurses. We'd go in and we'd chat. There was a lovely lady up there that used to take my blood, and I used to look forward to visiting her there when I was an outpatient because she'd always have a story to come back and tell you.
They remember your name, they remember your husband's name, your sister's name, anybody that has ever come into the hospital with you. And when you go back 3 or 4 years later as a visitor, they still remember those people's names.
And there are 500 people working there, you know. There's a lot of people working there, but they all seem to know you.
That easygoing human touch, as you're the individual, you're not the number.
Where else would you get that? The staff in other hospitals are run off their feet. So even though they might like to give you the personal touch, they won't have the time to.
There's a lot of people who are sick. They're at a very vulnerable stage in their life, and to be taken care of in such a manner is unbelievable.
My sister had 2 bouts of cancer, so she would have been in all kinds of hospitals and different places. And places she didn't like to be, some were good, some were bad. But when it came to Luke's, it was different. Luke's was like a home away from home. Everybody could go home knowing she was being looked after and that she had the best of care. And also the beautiful grounds.
The gardens are a very peaceful, tranquil place.
When you're living in Donegal, I could understand how people from Donegal could relate to St Luke's as being home from home to them, because it was bringing them back to the countryside that they're used to, the reassuring feel of the countryside.
Just smelling the flowers and walking around and sitting in the grounds in St Luke's was therapy in itself.
I know how hard it is for a cancer patient to get on a bus to go to Dublin, to go to a hospital to get treatment for radium treatment. But they'll go willingly to St. Luke's before they'll go to Belfast or Derry or Galway.
I'm one of those with you completely who believes that in order for recovery and healing to take place successfully, it is a great help to have a nurturing atmosphere.
It doesn't feel like a hospital at all. It's just this fabulous home from home.
There isn't another hospital really in Ireland that will do that for you.
So you wonder, are patients a priority in Ireland?
Next month, a new cancer unit is due to open at St James's, and this is a new building built as a public-private partnership, and you can see the state-of-the-art building. You can see the prefabs that are built right up close to the front door, and you can see the wonderful environment at St Luke's. What would you do? Would you go to the proven centre of excellence with a 50-year track record with the lovely grounds? Or would you go to the unproven private hospital that's just opened? Well, I know what I'd do.
This is about patient welfare, and should be, and not about people making money either individually or for departments, whether they're of health or anything else.
We don't need to do this. We're not gaining anything, we're losing everything.
The closure of St Luke's is going to cost patients' lives in the long term.
We are witnessing a massive experiment driven not by science, but by greed.
We hope that people will see the real background and how absolutely wrong it is. And we say in the book, get this book, get yourself informed, come to us if you want some more information, but then make an appointment with your local government TD and go down there armed with the information and say this is not acceptable.